1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good morning. I have to start off today by pulling on my ear. Some of you will know that reference to Carol Burnett. My mom said, pull on your ear today, and so I know you're thinking about me, Mom, so here you go. When I came in this morning, one of our longtime wonderful employees, Kim Shepard, told me that she's making a sign for her father. He's in a long-term care facility. And of course, he's been there and she can't go in to see him. And so she's making a sign now that says, Dad, you know, hang in there. There still may be time for the Cleveland Indians. He's a big baseball fan. So I think it's a wonderful sentiment. I think those sort of heartfelt messages for family, friends are out there. And so I think we need to recognize those things in these moments. So, reminding you what our central challenge is here, and we continue to work at. And Dr. Gullett has built a fantastic disease surveillance and response system for us, built it out using our existing epidemiologic staff, our expanded capacity with community physicians, public health doctors, preventive medicine doctors, medical students, and then we're also now gearing up as we go forward, as we're retasking existing staff. We have public health nurses that do things like newborn home visiting for moms with new babies. We have nurses that provide a whole range of services. They're being retasked to now get involved in the response components. They have been and continue to be, so we're constantly working in this continuous improvement cycle to assure that we have the best response for the moment. And it's actually a pretty amazing thing to watch, and I think it's we're really proud of what we're doing here locally. So we're doing our interviews of cases and also of their contacts, and those conversations continue to go forward. I think we have a very strong group of public health warriors that continue to work hard on behalf of this community to try and prevent transmission. We also are sending out, as you know, isolation and quarantine orders to folks in the community. We continue to do that to assure that they understand what they need to do when they're at home to keep themselves and their families safe. We've been working on a daily basis and sometimes an hourly basis with our safety forces, with EMS around protocols for addressing runs and response, working with local governments, the County Emergency Operations Center and County Executive Armin Budish, working with his staff around the distribution of personal protective equipment, working with the Emergency Operations Center staff around the distribution of needs that we're seeing in community, social needs to support people who are in quarantine and isolation that need assistance. And we're also working very closely with our hospital systems, our partners that are on the front line of response with EMS, and assuring that we understand data around testing that we can report to you on a regular basis, and work to identify challenges and to develop quick efforts to work problems and address concerns that may arise. And that's a partnership that's critical. Clinical medicine and public health are critical partners, and we're seeing this convergence of clinical medicine and public health, again, in a way that I think demonstrates the resilience of Greater Cleveland in a way that we can all be proud of. So we've been looking to gather data from lots of places. We get data in conversations with our state health department and other local health departments, our peers throughout Ohio and around the country who are learning in real time things that are working and where there may be challenges. Those relationships and those networks are essential so that we can continue to bring forward the best practices, and where there are challenges we can overcome them quickly to move forward. We continue to watch Washington, the state of Washington and New York, who in many cases they've had some significant challenges there, but also, as I mentioned on Monday, we're seeing a glimmer of hope that we're starting to perhaps see a downward trend in some places of cases. We need to continue to be vigilant. We need to continue to be vigilant because we know that this can be cyclical, and we're not out of the woods yet, and and we need to follow the plan, the Ohio plan, that's working very well. We want to talk about the fact that here we believe what we've designed here, we believe is the right approach for this community. We believe we are following a public health model that we believe is effective in the moment, and we'll continue to revise that model going forward, but we believe we're following a model that we think is an effective way to address the COVID response. We're going to continue with our updates 3 times weekly for the media. We know this situation continues to evolve every day. It continues to evolve every day. New guidance emerges from the federal government on a daily, sometimes hourly basis. And so we're going to continue to monitor the guidance that we receive that is based on the best new information. And we'll use that guidance to direct our activities. We have twice daily meetings that are coordinated around tactics. And so those meetings help us to decide what our activities are for the day, and then at the end of the day to basically summarize what worked and where we can address challenges. And I think that rapid cycle continuous improvement approach is a very virtuous cycle. So we know the governor's press conference. We talked about recently EPA issued a statewide order to maintain public water service during the COVID-19 crisis. It prevents water system shutoffs for people who have due to non-payment, for people who haven't paid their bills for one reason or another during this declared emergency. We think that makes perfect sense, and we appreciate the governor's support to assure that people have access to utilities that's essential. The order will help to assure that as many people as possible have safe water and access to hand washing during this response as well. So the governor reinforced the importance of this stay-at-home order and said we have to keep battling. We have to keep battling. We can't walk away or it's going to rear up and it's just going to kill more Ohioans. We need to recognize that the challenges and the disruptions that we're facing in our schools and in our businesses, in our daily activities about how we gather, and with Kim Shepard putting a sign in her dad's window at the long-term care facility saying, you know, Dad, hang in there. We have to recognize in those moments that those disruptions and difficulties are protecting people in Greater Cleveland. They're protecting the people that we all love most. And so we need to take those moments to recognize that these efforts to create a distance, and it's important to recognize that we're talking about really physical distance and not, we use the term social distance, but we're talking about physical distance but social connectedness. Physical distance but social connectedness. And so spend time keeping updated on what's happening and understanding the latest information. Call your family, check on your friends, check on your fragile neighbors. We have a family friend who's dealing with a situation now where her mother's in hospice. And so the world keeps turning for folks. People have challenges, very difficult situations. And so we see amazing things that people are doing for each other. And we also see some very difficult situations that are part of our lives. And we need to take a moment and recognize that and respect that and respect people's, respect the challenges that people are facing as we go about our day-to-day lives and lend that helping hand to our neighbors. And recognize again, young folks, that this 6-foot distance is important for you to protect the people that you love. We know businesses are working to protect workers as well. And we appreciate all these folks that are still on the front lines making sure that we have food we need to eat, that our healthcare workers are out there responding, and that the essential components around access to the medication that people need are available. And so people are monitoring their temperatures. Continue to do that. If you're sick, stay home. If you're a business, let people stay home if they're sick. We want businesses to do the right thing and err on the side of caution relative to the governor's order. If you care about your fellow Clevelanders and your work is not critical to daily existence, please temporarily suspend your business or work remotely. It's about what's right. I'd like to thank all the businesses that have chosen to do the right thing. Those that have taken a hard look at their day-to-day operations and have decided that temporarily closing is the best thing they can do for their family, neighbors, friends, fellow citizens of Cuyahoga County. It's the best thing you can do for people that you don't even know. I know that these are disruptions, but we're asking people to really step back and ask yourself in your heart of hearts whether you need to be open. And we would hope that you err on the side of caution. Before I hand it over to Dr. Gullett, there are some positive signs that we're seeing, and it's important to recognize that even in the moment. We know that Battelle in Columbus is now sterilizing masks. That's a good thing, to make more safe protective equipment available to our frontline workers. We know that the federal government is beginning to receive large shipments of personal protective equipment for our first responders and folks in the healthcare field. All those things are good news. And so even as we continue to battle and respond to this evolving pandemic, we need to recognize these bright lights and really spend time being good to each other. And remember that as Greater Cleveland, we are one community, and that is how we will best weather this storm that we're in the middle of. And so with that, I'd like to hand it off to Dr. Gullett and thank her for everything she's done and will continue to do for us.
Good morning. I'd like to thank, again, all of our media partners here in the room and those of you back at your offices. We really appreciate all that you continue to do and the sacrifices that you continue to make. I'd also like to recognize the Cuyahoga County Media Communications team, who's also here with us and has been. They spent some time with us on Monday recording training videos and information about how this prototype that we've built here, it's just one way to operationalize a local public health response in an unprecedented time where we need an army of volunteers that we aren't used to working with, but that we need to ramp up quickly. So they spent a ton of time with us actually recording videos and making sure that they're editing them and getting them onto our website, and we'll be able to share that with other local health departments and other medical schools and health profession schools who've reached out to us about what we're doing. So I just want to take a moment to thank you all for that. I know you have a lot of things going on, and that was a really nice thing that you did for us, so thank you. I would also like in this moment of gratitude to mention a few other folks, as I do on every press conference. There is really an army of folks out there who are supporting those on the essential workers on the front lines, whether they be in healthcare or other essential businesses. And it's just remarkable. I think it's what the best of our greater Cleveland community really has to offer. We've seen family, friends, strangers, acquaintances, grandparents, medical students, other health profession students rise up and create this volunteer corps that's doing things like watching our children, homeschooling them, picking up our prescriptions, picking up our groceries, things like that. And it's really been heartwarming and actually such an encouragement to me personally, and I know other members of our team. One of our doctors last night was talking about a medical student who is watching their daughter because they're both physicians and they're both on the front lines, and we can't thank you enough for that. And there are countless people doing this, and I couldn't possibly name you all, but I want the community to know how this is happening, and I think that we need to continue to encourage and love one another through this, and this is just an example of that, so thank you so much. I'd also like to thank our hospital partners. I continue to talk about our partnership with them, but we had yet another productive day of meetings and communications with all of our hospital partners yesterday, talking about how we can better improve our public health workflows so that we can ensure that healthcare employees are getting the most updated information as the CDC guidelines change to ensure our public health workforce and our healthcare workforce are able to serve, but also not transmitting infection. And there's constantly changing information, but I really appreciate our hospital partners helping us to understand what would better help them. And so I just want the public to know that this is something that, as Terry mentioned, clinical and public health together, but it's happening in real time. And so I thank all of you, those of you listening, and those of you who aren't, thank you so much for that. And then finally, I'd like to thank Heather. She is remarkable, as you all know, from every press conference over the last few weeks. But she continues to help me be better at talking slower and ensuring that our entire community gets this important message. So thank you for your commitment to our community, and thank you for helping me personally, and Terry too, I think. We apparently drink too much coffee before these press conferences and talk kind of fast, so she helps us with that. Okay, so I'd like to just move on to today's case information. Again, as a reminder, I'll give some targeted case information on Mondays and Wednesdays, and on Fridays I will give a more robust picture, including the EPI curve and zip code map of frequency of cases that you saw last Friday. That will enable us to show some trends and to help you better understand where our data are as we proceed through this crisis. Today's lab confirmed cases for the Cuyahoga County Board of Health jurisdiction, so that's all of Cuyahoga County except for the city of Cleveland, because our partners there are separately reporting their cases, is 409. The age range for the current cases is 11 months of age to 96 years of age. And the range of illness onset dates for these cases is February 29th to March 27th. I would also like to offer our deepest sympathies to those families who have lost loved ones to COVID-19 as I present you with updated death information regarding COVID-19 cases. We are standing with you. We here at the CCBH and our team, as well as our entire greater Cleveland community, stand with you and we mourn with you. This morning, we have 8 deaths. The age range of those deaths is 63 to 91. And those range of death dates is March 20th to March 31st. As you can see, case counts still continue to increase here locally and across the state of Ohio, and now, as you see, nationally across many other states. This reinforces the idea of widespread community spread of COVID-19. We've known this for weeks, we've been talking about it for weeks, but I just want to continue to remind people that what that means for you is that every time you're out of your house, every time you're doing essential business, you have a chance for either transmitting the virus to someone else or someone else transmitting it to you. And as Dr. Acton said yesterday, we really have to consider every trip to a store, every trip for essential business as something to be very careful with. So we know you need food, we do too, we know you need gas for your car, to get to work as an essential employee, but please just be thoughtful and careful and minimize the time in those trips and maximize infection control during those trips. The risk is really, really real, and we want you to continue to do everything you can to protect yourself, but also to protect those around you. You can see from the case age range of deaths that I'm presenting, we have older folks in our community who are dying from this, but none of us is immune to this. We are all affected. You see, we have now cases under 1 year of age. So everyone is at risk, and everyone needs protected. One of the easiest ways to do this, as I continue to remind you, and so does Dr. Acton, and so do all of our public health officials, is to stay home as much as possible. And in that, again, social distancing when you're out, but when you're home, social distancing doesn't mean social isolation. Again, please reach out to your family, your friends, neighbors, acquaintances, those who may be vulnerable. Please reach out to them through phone, through email, through some kind of electronic communication. It's really, really important. We've got to care for one another, and this is a long haul. This is a marathon, not a sprint, and we've got to make sure we're caring for one another every step of the way. And no one in our community can be left behind in this response. Absolutely nobody. So it's incumbent upon all of us to do our part. We're all being asked to exercise patience and ride this out, and that's tough, but I know that we are tough here in Cleveland. I'm from Northeast Ohio. We are a tough bunch, and we will get through this. We will rise through this, but we have to do it together. We are all connected, and we've got to make sure each of us does our job. So here at the health department, we promise you, we commit to you, we are determined to stay steadfast in our plan and the work that we're doing around case identification, contact tracing, cluster investigations, and surveillance. But it does take everybody doing their part as well at the individual and also at the organizational or business level. So thank you so much for your time today. We will take a few questions, and then we will provide you with more complete data as we
guys announced the cluster in the nursing facility in Parma yesterday. What's the latest on that? We have an idea of how many patients are involved.
Yeah, so the question is about the cluster investigation press release that we released in conjunction with our partners at Manor Care last evening. We have, as I've mentioned at every press conference now for the past few weeks, we've been working on cluster investigations in multiple areas, multiple sectors of our community, multiple employment, places of employment, multiple community organizations, multiple long-term care and skilled facilities. And so this was one that we've been working with for a few weeks. And sometimes we work with folks simply when someone becomes symptomatic. They don't even have a case, but they call us and we begin working with them, so we have an ongoing working relationship. And that was the case with our partners at Manor Care. They have been remarkable in their proactive response to this. And it's an ongoing public health investigation, so I don't have numbers for you this morning, but I can tell you that they have worked tirelessly to ensure that their staff and their residents are cared for and that infection transmission does not continue to occur and the highest level of infection control practices are implemented.
Is it half a dozen patients? Is it double digits? I mean,
Yeah, so it's an active public health investigation, so I don't have any specifics on what I can give you with regard to case counts, but I can tell you that we are working closely with them on understanding the scope and understanding how we can best support them. The Ohio Department of Health has also been a tremendous partner in this. We have regular phone calls with all of our cluster investigations, actually on a daily and sometimes multiple times per day basis. And so between our Ohio Department of Health colleagues, the other state agencies, Manor Care and our local health department, we're all working to identify and understand the scope of the issues there as soon as we can.
So Dr. Ballard, I have a question. So the contact tracing.
If I may, Rachel, one quick, I want to follow up and then you jump in. So I think it's important to recognize that, you know, across the country, really internationally, in Ohio and, you know, in our community, the CDC has put forward guidance around these long-term care facilities and skilled nursing facilities. They put forward the guidance on care because these facilities deal with challenges relative to their fragile populations around infectious disease all the time. And so they have protocols in place around how they address those issues in their institutions. The CDC has put forward very clear guidance on how facilities can minimize and address concerns that may arise in their institutions. And so it's because we're talking about fragile folks. We're talking about people's parents and their grandparents and their neighbors and their friends. And so we want to make sure that we're being sensitive to those issues, also protective of private health information as we go forward and moving through this response. And I want to remind people that we recognize, certainly Dr. Ackner spoke to this, that these are fragile populations and they are more at risk. And you know, these are real people we're talking about. We're talking about their lives. And so we want to make sure that we stop and remember that as we start to talk through these issues and as questions arise. And we're going to always side the way of being respectful to those involved first.
Regarding,
I think Rachel has started to talk. Terry cut her off. We'll get you next.
so you talked a lot about the contact tracing and what it can help you learn. And so I'm curious in doing that with this facility that I've talked to some folks that work there, whether you guys have found that staff that works in that facility, which has both long and short-term beds, also have worked in other local medical or healthcare situations, whether nurses or doctors or STNAs that float between the different facilities, and if so, what is the kind of strategy for managing that?
Excuse me. So the question is that once we get into a cluster investigation involving a healthcare organization, do we assess whether staff in those healthcare organizations work at multiple healthcare organizations, and then how do we manage that? It's a great question. This is a very healthcare-rich community, as we all know. We have robust healthcare from the entire spectrum, ambulatory care all the way to long-term care with acute care in the middle. And of course, we know that a lot of our staff and community members work at multiple facilities. And so that is actually one of the first questions we ask. When we start a cluster investigation, we walk through a very structured initial call that lasts anywhere from an hour and a half to sometimes 2 hours with sometimes our Ohio Department of Health colleagues, but certainly our full team here, as well as the full team with whatever organization this is. The agenda for those calls is 2 pages long, and one of the things we do is assess all of the employees and where they work. And in this particular time, this is true of any infection outbreak, this is not specific to COVID. Anytime there's an infection transmission, we always try to minimize transmission, which would be particularly important for people working between buildings within the same organization, but also working between organizations, because we would never want someone to be infected with this and then unknowingly transmit it elsewhere. And I will tell you that every single partner involved in any cluster investigation to date has absolutely agreed with that, and so have the staff who have multiple jobs elsewhere. So this has become the mainstay of the way we handle employment in healthcare in this particular crisis, but it's not unique to COVID-19. It would be the same if we had an outbreak of C. diff or an outbreak of influenza or an outbreak of scabies or anything else that's, maybe a little less toxic than this infection. So that is something we've addressed with every single partner we've dealt with, and that's not specific to healthcare either. I mean, we have other employers that are in non-healthcare sectors that are essential businesses. Sorry, I'm talking fast, I'll slow down. And in those cases, we also are making sure that those folks are not moving between employment sites. Great.
Thank you. I'm wondering, I think earlier this week or perhaps last week, I learned that, because of privacy concerns, municipalities aren't necessarily looped in. Local governments aren't necessarily told when there's clusters or cases. So I guess I'm wondering, when we're talking about firefighters or EMS workers or police who have to go to some place like Manor Care, do they know if they're walking into a hotbed, and how's that work?
So I'm going to answer the clinical part of that, and then I'll let Terry answer the other side of that. So that's the sort of tag team that the two of us are doing as far as addressing these issues holistically. So we have a very close relationship with EMS and fire and first responders in the community. We've had frequent meetings, and in fact, I've been on the phone with a lot of fire chiefs and EMS folks regularly over the past week around this issue to make sure that everyone is protected. So partly it's around ensuring they have protective equipment that's adequate, but part of it is also ensuring that they're prepared when they go on a run. And in fact, we have a meeting today with our EMS partners, Terry and I both today. So I want you to know that's an ongoing dialogue. But given the prevalence of COVID-19 infection in the community at present, every single run should be suspected to be on a person with COVID-19. So at this particular time, we expect that every single EMS run, every single time an encounter happens, we would expect to assume that that is a COVID-19 case. And that is what we're communicating with our EMS partners, and that's how they're managing their runs. We're trying to be as open as possible around where we know we have clusters, but it's rapidly changing, and it's also an issue of balancing protected health information. So Terry is working on the side with our elected officials and other municipalities to help us all be on the same page. But the bottom line is that this infection is everywhere, and quite honestly, our skilled facilities in particular have been really great about ensuring they have contracts with private ambulance transport, so that when there's a non-emergent transport that requires, say, a direct admission to the hospital, someone's getting sicker at the facility and maybe needs to get admitted, they already have proactively those relationships set up, so they can call a non-emergent transport. Those people have full PPE. They know that this is a concerned possible COVID case. Then we have a safe transport, and then those people get to the hospital and they're safely isolated immediately. The issues that now 911 is being called for, we're working with folks to make sure that those are limited to real code situations, meaning somebody is truly coding and we need an EMS response to work that code, rather than a transport where we know someone needs hospital level care, acute care, but they're not in a code situation. So we're really working to try to preemptively make sure that people aren't surprised by calls. So that's the clinical side, and I'll turn it over to Terry on the communication with our elected officials.
So, I think Dr. Galt did a great job of actually answering the question, I think, almost completely, as Joe's does. And so, you know, I'm a son of a fireman, a brother of a fireman. And so these issues matter to me. And so we've been right along working with EMS, and we'll continue to do that. But I think it is important to recognize that we know that it's out there, and because of some testing limitations, we have to make assumptions about safety on every run. And that has been communicated to EMS, and I think that is the most protective way to proceed. Because it would be a false sense of security to suggest, well, if we know, you know, if we think we know somebody that may be positive here, what about the next house? What's the risk? The risk is, it should be considered the same across the board in this community right now. Universal precautions. I remember having these discussions during Ebola, you know, with people. There was fear, but universal precautions is the safest way to protect your workers. So we're in conversations during any outbreak situation with those that need to know information, and we're very protective of public health information, but also trying to be protective of those frontline people. You know, I have to go home and look my well, at least virtually anymore, look my dad in the face. He and my mom are sitting pretty tight at home right now, thankfully. And you know, talk to my brother about that. And so I would give them the same consideration as I would give anyone out there in this community. But from a public official standpoint, if they need to know to have the best situational awareness, we'll do that on a case-by-case basis going forward, as we always have in any outbreak. And as to the specifics, these are very unique situations, and each one will address in a way that we think is the appropriate for any given situation in any given community. And there's going to be some variability there, so I just know that we have these long-standing relationships that we rely on in these instances, and I think that they serve us well. So I think that's all we really have to say about that.
To be more specific to, like, say, the manor care situation, if you know there are people in that facility that have worked in other facilities, or, you know, they work closely with Southwest, are you doing both specific and general messaging, saying, we know people who have worked in this facility, you know, have been exposed to this, and they may have worked in this hospital or this setting? Because I think there's probably patients who have been in those settings who want to know, you know, what is the time frame for this?
Yeah.
Was it doctors or nurses? And so I think individuals being notified is one thing, but also just, are there other notifications that there could be exposures that go out to other nursing facilities, other hospitals, other?
Yeah, thank you, Rachel, that's a great clarification. So, so let me just finish up before I answer that by saying, there's a really special place in my heart for first responders, EMS, firefighters. You know, I continue to try to bring humanity to this crisis any time I can. And my husband and I started out both as firefighters and EMTs, and actually that's how we met. We left our wedding in a fire engine. And that's where my heart really is. And so I just, you know, want the community to know that not only as an organization here at CCBH do we want to make sure you're protected, but we want to do everything we can to ensure you have the right information. But also, please know that this is, as much as it is a personal, close to Terry's heart, it is to mine too. And so know that about us. We care so deeply about your work, as we do for everybody in our community, but we have personal connections to fire and EMS. Rachel's question is about the messaging with regard to people who may have been exposed by healthcare workers and those particularly moving between facilities. So let me talk to you about our approach for contact tracing when that's the issue. So we have several approaches with regard to contact tracing when a healthcare worker is the person who is positive and who may have encountered others in the facility. That's not just long-term care, that's hospitals, that's other employers. So what we do, and actually I'll tell you, that's also houses of worship. I've had this very issue with houses of worship and some schools that continue to be part of our cluster investigations prior to the schools being closed. So what we do is do a very detailed individual contact tracing identification. So that includes working with infection preventionists at each of these facilities, who are usually nurses, who we have a very close relationship with normally outside of COVID-19. They provide provide us with individual names of coworkers or other employees, as well as patients. And then what has happened, most organizations are following up with the employees in close conjunction with us and doing that education around what that means as far as the exposure. And then we're following up with all of those patients. It happens multiple times a day. It's a lot of people, but we're doing it every single one by one. And that also includes people who they may have experienced or interacted with in another facility. Right? So we don't stop. We are disease investigators, and we go as far as the investigation takes us. And oftentimes it is a very long process. Sometimes I'll have one physician or medical student working on one case almost an entire day, because we don't want anyone to be left behind. We want no stone unturned. So it's important for us to make sure everyone gets that individual messaging if they are at an increased risk. Secondly, we provide general messaging for those who may have been in the vicinity but not deemed a close contact with that person. So somebody who may be in the facility or who may have been in attendance at an event. Particularly, I'm thinking of a house of worship where this happened. We have multiple cases who were closely identified as interacting with the person who was positive, but there were a lot of other people at that event. So I worked with the leader of that house of worship to craft some general messaging. So we have both approaches, and we want people to be as informed as possible about their level of risk. So that's absolutely our approach and something that's really important. I know you had a question.
This is the last question.
Yeah, I was just gonna say, since this care facility is elderly and they're at higher risk, are you guys approaching your investigation a little differently than other cluster investigations?
The question is whether we're approaching this investigation differently, given that the population of long-term care is typically an older population. That's generally the case, that people in long-term care are generally a little bit older, but not always. I mean, they may be people who are recovering from what we call post-acute care, which is a surgery. They might be a younger person who had surgery. They might be a younger person that has chronic illnesses. So we are really not handling this any different than we would any other cluster investigation. It is always our desire to care for everyone in our community, but when you think about equity and you think about what that means, we're always ensuring that those most vulnerable have an approach that ensures their safety and their health. And so I believe very strongly in an equity approach where everyone in our community has an opportunity to reach their full potential and their full life. And that's not just during COVID-19, that's during every single day of every year. And so that's the guidance by which and the lens we use for every investigation, COVID-19 or not. And this is a vulnerable population, so we will throw in any resources we need or deem necessary to ensure we adequately address what we need to for that population.
Thank you very much.